So my name is Krista Fraize. I am a registered pharmacy technician here at the Pembroke Hospital, and I have been here for 14 years. People are most often surprised to find out that we are actually a pharmacy that gives medications to patients that are here in hospital. Depends on the day, but some days I will be in the sterile role, working in our hood rooms, either in the making chemotherapy for our medical daycare patients, immunotherapy for our medical daycare patients. I make epidural CADs. I make post-op or palliative pain pumps for patients. Multiple different products that are required by the OR for different procedures that they're doing. Eye bags, ortho bags. We make magnesium bags for the emergent ICU department. Lots of things between the sterile world when I'm in the blue scrubs like I am today. I am also a med rec technician here, which means any patient that gets admitted here in hospital gets a BPMH done as their home meds to get a history of what they were on at home prior to coming to hospital. That gets put on the chart for the doctors to review and to address, make sure nothing is missed. Maybe meds need to be changed, maybe doses already have been changed. What else do I do? Order entry. If I'm in the pharmacy department itself, then I'm just based on entering orders that the physicians have written on patient profiles. They get validated by the pharmacist. I receive the order some days when our drug order comes in. Lots of things. Lots. There's a lot going on in pharmacy. So what we used to do before was something called traditional fill, which means typical of what you would find in your retail pharmacy when you go and get a prescription filled. We would have been putting the medications for patients admitted here into bottles. We would count them out by the week because they would be a weekly batch fill. So you get 7 days supply of medication that would go down to the floor for said patient. It would go in the patient's drawer. The nurse would grab from those bottles to administer the meds. Now, with that gone, the cabinets are loaded with the medications, all unit dose, packaged and prepared. So all we need to do in pharmacy, makes it sound all we need to do. But what we need to do in pharmacy now is we get the orders from the floor, we type the orders on the patient's profiles, the pharmacist validates for any kind of interactions or different kind of therapies. They have a whole slew of things that they do behind the scenes to make sure that patients are getting the best care. And once that order is validated in the system, the nurses can then get that med out. So there's no waiting for us personally anymore. Like sometimes you could be waiting up to maybe an hour, if not more, for us to have that whole process complete, the meds counted and down to the floor. Whereas now I could get your order from the floor with an image capture, put it on profile, have the pharmacist validate it. The nurse can have that medication out within less than 15 minutes. I'll speak to sterile alone, the fact that we can treat patients, our cancer patients here, without having to send them all the way to Ottawa for certain treatments. That's a huge deal. Like, I like being a part of that. I like knowing that people are getting their care close to home. I also like knowing that now people are getting their medications a lot faster with these new ADUs. Like, it's less wait times in terms of getting like their stat doses to try to help people in their time of need, basically. They come here because they're sick, and we give them the medicine to make them better. We are a huge team. We all work well together. It's another reason why I like working here, and they make the job bearable. Some days are easier, some days are not, but without the team and the people that I work with, it would be very hard to get everything done through the day. Definitely. We all work well together. If somebody doesn't pick something up, somebody else will then do it, or you can leave notes. We all work really well together, and it's a big bonus.